Well, Republicans may be vowing to repeal Obamacare, but with no replacement lined up, what would happen next? Avik Roy is the Forbes opinion editor and president of the Foundation for Research on Equal Opportunity, and Austin Goolsbee is President Obama's former chief economist. Great to see you both. So that would be a pickle, right? I mean, Avik, you are the person I think knows the most about this stuff, with all due respect to Austin. But we've been talking to you about Obamacare since I don't know when, since Obama was like a baby. and you tell me, if they manage to repeal and they are not able to replace, what happens?
Well, Megan, there's one word in this whole Obamacare fight that matters more than any other, and that's the filibuster. I've done something really special tonight, Megan. I've stolen Karl Rove's whiteboard. I got it right here.
Oh, this is good. We like props.
Here's something that we're going to show you. That the thing that Obamacare did and had in 2009, 2010, when Democrats controlled the Senate, they had 60 votes to pass the key parts of Obamacare. Republicans this time around only have 52 votes. And that means, yes, they can defund Obamacare. They can take some of the funding away from Obamacare. But the thing that you and I have talked about so many times on the show, Megan, is how the regulations in Obamacare are driving up the premiums. And if you don't reform the regulations, you can't really repeal and replace Obamacare in full. So how are Republicans going to get to 60 votes that they need to impose or institute their own reforms of the health care system? That's going to be a challenge. And what I've argued is that the way to do it is to give Democrats something they want. Cover as many people as possible, but do it in a consumer-driven way in which people have actual choice as to the kind of insurance plans they can buy.
So you heard it there, Austin. They need Democrat buy-in if they want to do it right. And if they don't do it right, we're back to Trump's warning, which is be careful, because right now this is hanging around the necks of Democrats to the extent Obamacare is not working, and it could soon be a Republican problem.
Oh, it is a Republican problem. Are you kidding? Look, Megan, we talked about this throughout the campaign, that Donald Trump was proposing things that he contradicted himself. He wanted to keep parts of the law. He wanted to say get rid of the whole law. And experts from both sides kept saying, wait a minute, it doesn't make sense for him to do what he's saying would blow the system up. And now he's actually going to be the president, and they're trying to sort it out, and they're not going to be able to. The problem that Obama had is when you do anything in the healthcare system, you then own everyone's problems, everything everyone hates about the healthcare system.
Everything that's ever happened in the healthcare system is on you.
All that stuff they attribute to Obamacare, even things that had nothing to do with Obamacare. And now the Republicans are about to do the reverse. If they get rid of Obamacare, if they fundamentally alter it, anybody's complaint about the healthcare system will be transformed into, well, what did you think was going to happen when you destroyed Obamacare?
And yet they have to do something, Avik. They have to do something. Trump ran on a promise that he would. These Republicans are from districts that want it repealed and replaced. And there is a real question about whether Senator Schumer is right. You can't take away, you can't still have the good stuff, the universal coverage, or, near, whatever, the coverage of pre-existing conditions without, he didn't say it, but without the bad stuff, the mandate.
Yeah, and this is where Democrats, in my view, are totally wrong. At my think tank, the Foundation for Research on Equal Opportunity, you can go to our website, freeop.org. We've published a plan called Transcending Obamacare that does everything that Democrats claim to support. It covers more people, 12 million more people than Obamacare, but at 20% lower premiums, with much more choice, much more access. It can be done. This idea that Obamacare is the only way to make sure that people have access to health insurance coverage is not true. If you give people the choice, if you give Americans control again of their own health care dollars, they'll be able to choose the plans that are right for them at much lower cost than Obamacare does. So I don't think it's an either-or choice.
All right. Well, I think it's interesting. Donald Trump interviewed and sat down with Dr. Ezekiel Emanuel, who he really knows a lot about Obamacare. So he's the architect. And listen to him. He's got a lot of thoughts on how you could potentially keep the good stuff while, while getting rid of the mandate, although he doesn't love that idea. Great to see you both.
Thank you, Megan.
Great to see you, Megan.